Hey everyone, welcome to today's presentation on reactivity in dogs. My name is Nick and I'm a certified dog trainer and behavior consultant under German animal welfare law. I'm currently based in Berlin, Germany. I offer in-person consultations in Berlin and online consultations worldwide in English. I am also a full member of the International Canine Behaviorists. And today I'll be talking about reactivity in dogs. I will mainly be focusing on reactivity displayed toward people or dogs on leash, or what some people might refer to as leash reactivity. But a lot of the concepts we'll be talking about today can be applied to dogs that say bark at the mailman, cars, people, dogs going past their homes, and so on. So reactivity, what is it? When I talk about reactivity, or more accurately, reactive behavior, I consider it to be an overreaction towards certain stimuli. So I wouldn't consider a dog that occasionally growls or barks at a particular dog that they don't like approaching them out in a walk, or a dog that gets startled by a sudden loud noise to be reactive. But a dog that, say, consistently barks at dogs or other stimuli in their environment, even when those are not approaching or they're far away or they're not a threat, those I would consider to be reactive. So it's very much that overreaction, which is in line with most of the definitions you'll likely find. These dogs often also take a prolonged period of time to recover from a reactive episode. So as I alluded to in the beginning, categorizing the dog's behaviors as being reactive would be more accurate than labeling the dog as reactive. The behavioral displays are the observable parts, but the underlying causes or emotions could be ones like fear and frustration, which we'll explore soon. So some common triggers would be, say, barking, lunging, growling, ear snapping at other dogs, people, vehicles, skateboards, bikes, e-scooters, other moving objects, the mailman, birds, scents, noises, and so on. So it's quite a wide variety of potential triggers. So causes of reactivity. This is not an exhaustive list, and none of what we'll be discussing today is exhaustive in any way, shape, or form, but some of the more common signs you'd find. So some of the common causes we might see are things like fear and anxiety, the dog's social history and early socialization, frustration, and pain and underlying medical issues. So fear and anxiety could develop from a variety of things. It could be negative experiences with other dogs or people, or simply a lack of exposure to them, or maybe the dog got attacked in the dog park. If the reactivity is displayed on leash, a lack of a flight option due to the leash can make some dogs reactive only on leash, but fine off leash. Negative associations due to certain training methods, such as the dog, say, wanting to greet another dog, but then getting yanked away or yelled at because the dog's guardian decides they don't want the dog to greet. This can over time create a negative association with other dogs as dogs come to predict unpleasant experiences. And positive socialization, especially during the 3 to 14-week period, to people, dogs, other stimuli such as loud noises, vehicles, other animals, plays a huge role. Like the dog's early environment plays a crucial role here. Genetics are also important to consider, but I won't really dive into those today, as a lot of people also have mixed breeds that can make it difficult to really determine their genetic makeup, but do keep the genetic aspect in mind as well. Barrier or leash frustration, so an inability to greet other dogs or people. This can cause some dogs to, say, pull, lunge, bark to go greet other dogs. It can be especially prevalent for dogs and puppies who are, say, allowed to greet all people and dogs on walks. And so one day when the dog's guardian doesn't have time to allow the dog to greet due to time constraints and so on, and the dog gets frustrated by the inability to greet, as this has previously been the norm. So it's not uncommon for people to let their dog greet all the dogs they meet in order to socialize their puppy, but it can set unrealistic expectations that can fuel frustration later on. So it's best to teach dogs that some dogs and people are okay to greet and others are off limits to avoid potential frustration in the future. And then things like pain and other underlying medical issues can play a role, and they can make the reactive behavioral displays more likely to occur. This could be anything from an ear infection to thyroid problems to hip dysplasia, arthritis, and so on can exacerbate reactivity. It's not really different to say a human having a headache and being grumpy around other people because of the discomfort. It's also why it's so important for behavior professionals to be able to collaborate with our vet colleagues to ensure that we have a full picture of the dog that's in front of us, as well as finding a vet who's willing to take a good look at the dog and do further testing where necessary. It's really important that we can correctly identify the function of the behavior and the underlying causes, so we can implement the most appropriate management and behavior change strategies, which we'll come to later on. So body language. Body language is also hugely important because it's how we can sort of gauge outwardly how the dog is feeling on the inside. We obviously can't ask the dog, how do you feel? But we can very much read their body language and use that to guide us in our behavior modification and what situations we expose the dog to. So this is not an exhaustive list, and it's not necessarily linear in terms of escalation either. But these are some of the common signs of fear, stress, and behavioral escalation. In the next slide, we'll also be looking at the ladder of regression by Kendall Shepard. So some common signs include lip licking, ears back, tail down, panting, yawning, head turn, whale eye, shake-offs, stiff body, short lips, freezing, tail tucked, hard staring, weight shifting backward or forward, high flagging tail, barking, growling, agonistic pucker, and snapping. Whale eye, for those who don't know, or like when you see the whites of the dog's eyes show, and so that could either be away from the trigger or towards the trigger. It's usually they're concerned about something in the environment. It's also important to note that it's really important to look at these behaviors in context. So lip licking could be a sign of minor stress, for instance, but your dog could also be licking his lips while you're preparing dinner for your dog, and that's probably not stress related. So important to keep context in mind. So as I said, the ladder of regression from Kendall Shepard, and again, like you won't necessarily see these escalate in like a linear fashion, but these are some of the common ones. And we can use these to sort of gauge how comfortable the dog is in their environment. So in the sort of like green zones, we have things like yawning, blinking, nose licking, turning the head away from the trigger, turn their body away from the trigger, sitting, pawing, and walking away from the trigger. And you start to see slightly more discomfort in the dog. So creeping and ears back, standing crouched, tail tucked under, and then it escalates to lying down, leg up, stiffening up, staring, growling, snapping, and all the way to biting. So when we do our behavior modification and our management as well, we want to very much be like no further up than like the green arrows down here, generally speaking, to make sure the dog's actually feeling comfortable in the training environment. So management, hugely important, because it's important to prevent rehearsal as much as possible as the dog successfully getting other dogs and people and so on to go away by displaying the reactive behaviors. It strengthens the behavior and it makes it more difficult to change the behavior later on. And similarly, a dog that's frustrated and wants to interact with someone would also have their behavior reinforced by being able to access those stimuli via barking and lunging, etc. So good management is key to any successful behavior modification. I know managing the environment is not always easy, especially in an urban environment, but it's important to manage the variables we can control as best as possible. And these can include safety, so things like leashes, muzzles where appropriate, baby gates, and exercise pens. Limiting the exposure to triggers, so reducing walks and the duration of walks, going at quieter times in quieter areas, crossing the street and using environmental barriers like cars to get away from a trigger, using barriers to block visual access to, say, windows, dogs that bark out the window, using music or white noise to mask the sound of triggers. Top behaviors can also be really useful. So things like teaching eye contact or like a hand touch or find it or other search games, a U-turn to get away from the trigger, or things like pattern games can be really helpful. Enrichment, important, but things like training, sniffing games, food puzzles, and play. And you can find a lot of ideas if you go to the website 100 Days of Enrichment, or just search 100 Days of Enrichment and it'll come up. Also, it's important to note, not all of these are lifelong management strategies necessarily. But there are ones we can use while we get started on the behavior modification, which we'll get to soon. So safety, using leashes and other barriers to prevent the dog from gaining access to the trigger is important for safety purposes. For some dogs, especially dogs that may be ear snapping or has bitten, it may be useful to train the dog to wear a muzzle in certain situations. The muzzles used should allow the dog to pant, eat, and drink, and they can be acclimated over time using food and play to make them pleasant for the dog to wear. So it's important not just to slap on a muzzle and call it a day. Now, limiting exposure is very important because we need to prevent the rehearsal of the behavior as much as possible. Otherwise, behavior modification will be very difficult if the dog's frequently and successfully rehearsing the reactive behavior displays. So taught behaviors, these can be used to get the dog's attention onto you or to move the dog away before they get too close to a trigger and might react. And enrichment, meeting your dog's needs is always important, but especially for reactive dogs that may have less, say, outdoor exercise or sniffing time due to the reactive displays. So some of the listed behaviors, like the taught behaviors and others, can provide good mental stimulation using positive reinforcement training. Play, sniffing games, food puzzles like snuffle mats and Kongs can also be good ways to ensure your dog's needs are met. And again, I highly recommend 100 Days of Enrichment for further ideas because there's a lot of creative stuff on there. Behavior modification. So before we actually get to this slide properly, before we engage in behavior modification, we can use functional behavioral analysis to create the most appropriate behavior modification strategy. So that means we're identifying the antecedents or the dog's triggers that elicit the reactive behaviors and the reinforcing consequences for the behaviors. So let's take a look at two dogs, for instance. So examples, let's say we have dog A. Dog A sees a dog appearing, dog A barks and lunges, and the other dog goes away. This means that the reactive behavior has likely been reinforced. Or say we have dog B sees a dog, the dog appears, and dog B lunges to get to the dog to greet. And then dog B's lunging gets dog B to greet the other dog. So this behavior has likely also been reinforced. So as we can see, the motivations for using the same or very similar behaviors can be very different, and the reinforcing consequences can be totally opposite. So for dog A, the goal is very much to increase distance, and for dog B, the goal is to decrease the distance and greet. So again, this is not an exhaustive list either. There are many other force-free and positive reinforcement-based protocols you can use out there for helping your dog feel better about the triggers, but these are some of the common ones I tend to use. So the first one is desensitization and classical counterconditioning, positive reinforcement of alternative behaviors, or what's also known as differential reinforcement. The Look at That game from Leslie McDevitt's book, Control Unleashed, LAT for short. Behavior adjustment training, BAT, from Christian Stewart's BAT 2.0. Are some of the common ones I typically use. So desensitization and counterconditioning, these are often used in conjunction. So the desensitization part, we expose the dog to a trigger at a distance and intensity where the dog's relaxed. And then we can include the counterconditioning by pairing up the trigger with, say, a high value treat or similar, so that the trigger comes to predict good things. Some of you may be familiar with Jean Donaldson's open bar, closed bar method from her book, Dogs Are from Neptune. This is a counterconditioning procedure where the treat party happens only when the trigger appears. So that's when the bar opens. And as soon as the trigger disappears, the treat stops, the bar closes. So for positive reinforcement, differential reinforcement, we have lots of different options. So here it's really useful to use like clicker training or marker training. So using a conditioning word like good or yes, so we can let the dog know what behaviors we like and we can reinforce those. So and we condition these words in advance. So by repeatedly saying either good or yes or clicking a clicker and then giving the dog a treat, so that the word comes to predict treats. So one simple strategy could be marking and reinforcing the dog for looking at a trigger at a distance where the dog's calm and not displaying any reactive behaviors. Another one is engage, disengage. Some of you may have heard of this concept before, where first we mark and reinforce the dog for looking at the trigger, and then we switch to marking and reinforcing for disengaging with the trigger. And similarly, we can use these techniques to build up, say, like eye contact with the handler over time. We could also use, say, a previously taught behaviors such as like hand touch or leg targeting, and then cueing those and reinforcing those behaviors in the presence of the trigger, which can then turn into an alternative behavior for the dog to perform instead. We also get the counter conditioning effect from all of these as the trigger is paired with high value reinforcers. So look at that, or LAT, is similar to the marking and reinforcing the dog for looking at the trigger, but LAT is the cued behavior. So it would be like teaching the cue, like look at that, or where is, and then the dog points out where the trigger is in the environment, you mark and reinforce. BAT 2.0, which is the new version of BAT, works mostly on desensitizing the dog to triggers by allowing them to navigate the triggers at their own pace on a long leash. And for all these procedures, it's really important to manage the distance, the intensity, and the duration. So how far away is the trigger would be the distance. What is the trigger doing? Is the trigger just walking around casually with their side turned to your dog, or is the trigger directly approaching your dog, which is obviously much more intense? And then how long we expose the dog to their triggers during each training session. These are all important things to keep in mind for successful behavior modification. The adjuncts list is not exhaustive either by any means, but these are some of the common ones that can aid in behavior modification. So we have things like pheromones or DAP, supplements such as zolkine, and then behavior medication like daily situational, like antidepressants and benzodiazepines, for instance. So dog appeasing pheromone, or DAP, also called adaptil, come in a form of collars, diffusers, or sprays, and these can help ease anxiety for some dogs. Supplements like zolkine can also reduce anxiety for some dogs. This should be discussed with your vet before giving it to your dog. And then behavior medication in form of daily medication such as fluoxetine or clomipramine. These can help reduce anxiety and fear in dogs. And similarly, situational medications like benzodiazepines can help dogs that really struggle in certain situations. These should be used in conjunction with behavior modification, and they will need to be prescribed and supervised by a vet or a veterinary behaviorist. But they can be useful to aid in the aforementioned behavior modification strategies for dogs that really struggle or have a variety of anxiety issues, for instance. So this is not really linked with how to deal with reactive behaviors, but it's really important to be empathetic toward yourselves and your dogs, as well as others going through reactive issues with their dogs. Reactivity is stressful for everyone involved, including the dog that's struggling. The majority of people, it might not always look like it, they are mostly trying their best with the knowledge they have. And while I would never advocate, say, jerking a dog's collar or spraying him with water or yelling at them when they do bark and lunge at a trigger, people tend to do this out of frustration and desperation. So rather than judging them, it's better to be as empathetic as possible, and perhaps, where appropriate, guide them toward useful resources or professional help from a force-free dog professional. I'd also encourage people to reach out to a certified force-free behavior professional if you start to see signs of reactivity in your dog. The earlier you intervene, the easier it will be to treat. The easier it will be to treat the reactive behavior, generally speaking. So thank you very much for your time, and thank you very much for watching. I hope you found this presentation useful. And if you have any questions, feel free to reach out, and I'll be most happy to answer them. Thank you for your time. Have a great day.